Morning, everyone. Good morning, good morning, good morning. Welcome to Wellness Saturday, and this is day 20 in health COVID-19 updates. I hope you are finding it useful so far. For the last 20 days, obviously, we miss the Sundays because Sundays are just for you and your family. So, this is our Wellness Saturdays, and I think it's important for us to be very, very intentional about both our physical and mental wellness. It's so crucial. So I will be talking about that today, but I'll give you a bit of an update from yesterday. Again, as I said yesterday, the pandemic is still going on. We are doing our best, I'm sure as you are, to do our bits, which is stay indoors. Don't go out unless it's absolutely essential. The United Kingdom is still seeing so much sadness and loss. Can you hear the bird song? I think that is so beautiful. I love the bird song in the morning, and it's just so refreshing. It'd be nice to know what you all think. So yes, United Kingdom, again, death rates are still going up, and closer to 4,000 than 3,000 now. And again, the same with United States. Africa still has the list. I think total in Africa is still not up to 10,000 across the whole of Africa. And in Nigeria, it's I think the total confirmed cases is 210 or something around that level. So clearly there is a difference in the way this is affecting Africa as opposed to the rest of the world. And I wonder what that is. This is a time when Africans need to do their research to figure out whether it is a systems problem where people are not testing, or whether Africans are just not getting the coronavirus as much as the rest of the world. It's very, very interesting. I don't want to play into any conspiracy theory, so I'm not going to be doing that. Also, it's there was some news about some French scientists discussing about testing vaccines on Africans, in a very derogatory way. And watching it, they were speaking in French, and Didier Drogba then sort of retweeted on his own timeline that this is really disgusting and it shouldn't be done. So why on earth would you want to test a vaccine in a continent where people are not affected as much as the West? Shouldn't the vaccine be tested in China, in England, in Italy, in Spain, the countries that are worst affected? So I found that very interesting, and I really don't know the thinking behind that. So if there are any scientists watching that know why this French scientist decided that Africa was the best place to go and test vaccines, or to suggest it even, it will be interesting to note. Anyway, so that's the update from yesterday. Again, I don't watch the news that much because I feel like it's not positive. But one other thing that was being discussed was about face masks. And that I think in America they're trying to make face masks sort of recommend that everyone wears face masks when they go out. This has been a debate from the very beginning. When this all started, and I took my children out, or I put face masks on them, always did, because I feel like if you have a face mask on, then the most likely thing is that you wouldn't touch your face. And if you yourself have the coronavirus yourself and you're not having any symptoms, then you wouldn't infect other people. So I still think wearing face masks is a good idea. I don't really enjoy or like it, but I think it's a good idea. This is the one that we have been given as healthcare professionals in primary care. Is an IIR splash mask. So this is supposed to avoid you getting splashed by droplets from patients, or someone is sneezes in your face. But and I think it has a filter on one side, and then they're supposed to tie that behind our ears. I mean, I don't know how much faith I have in this, because some of the patients that were being asked to bring in are people that we suspect of having coronavirus. So I'm not sure, but I can definitely wear this out on the road and just sort of tie it like that and have that. So I mean, but I've been seeing some really nice looking masks that some of my friends have been wearing, even with complete with like filters on the side. I think if you have one of those, send one to me. Maybe that might be useful. So yeah, so that's what's in America so far. Everybody wearing masks. And another friend said, you know, she grew up in Japan and this was just normal for them. It was considered to be polite to wear masks in public. The truth is, when we're talking and when we are, you know, we are constantly spitting. You know, you might not see the spit, you might not feel the spit, but you're constantly emitting droplets when you're talking. So I think I wouldn't be very averse to wearing a mask, you know. And you know, about, I think on the 20th of February, I got very unwell. I was very ill. With, you know, and I put it on my Twitter page. If you want to follow me on Twitter, please feel free. Just search for me at Simisola10 on Twitter. And I put it on my Twitter page at the time that I've been so ill, and I've never been this ill, and that I think that I knew when it happened. The patient gave me this coronavirus. It was whatever, I don't know whether it was coronavirus. Gave me this virus, and I was so unwell. I was coughing. I had a fever. You know, I couldn't go to work. I've never signed off work before, but I actually couldn't go to work for 2 days out of that time. I went to the work for the other times because I had sort of an inspection, a management thing I had to fulfill. And now looking back, I feel bad having gone to work then, because I don't know who else will have infected with the virus. But you know, if we're all wearing masks, or patients weren't coming in with a cough, you know, it would have made a difference. Anyway, I feel like I'm going on and on a bit, but I think wearing masks, I kind of support it. You know, the scientific evidence is still shaky, so this is my personal opinion. Scientific evidence is still shaky, but I would much rather prefer that if you were talking to me at this time, you were wearing a mask. and although, you know, and then also it will prevent you touching your face. I think if you have a mask on your nose, then you're not able to really touch your nose and your mouth as much. It would be nice to hear your views about masks and the rest of it. But yeah, I find that very interesting, and I think healthcare will never be the same after this. I think hopefully it will never be the same, and doctors and nurses and healthcare assistants and admin staff will be protected from patients who are really, you know, on the first or second day of their illness, when they don't need to see a doctor. That's the time when you need to stay at home, and people don't get as infected. Of all the patients that I'm playing, I think out of hundreds of patients, maybe 2 or 3 would need to be seen. You know, the rest don't need to be seen. So I think telemedicine, you know, and virtual, the way to go. You know, is the way to go. There really is no need to go and see your doctor unless you have to be examined. And there are only very few times when you need to be examined. So if somebody develops a mass, I think they have cancer, they are coughing, and it has 2 weeks. You know, there are specific instances, but the rest of the time, I think virtual to go. You know. Anyway, I've gone on and on a little bit. It's supposed to be about wellness, and what's been on my mind is been about people who are older than sort of over 60, let's say over 65, and you know, the much older generation. When we're all doing all these exercises and talking about wellness, we don't really think about them, and it's important that we also include them in the prevention journey and how people should live, you know, a healthy life, and the exercises that they should do. So last week I talked about, you know, deep breathing, which anybody can do. I talked about the plank. I'm not sure if any people over 70 are able to do the plank. But I wanted to show you about just like step ups and just sort of sitting and standing will be really useful to do. So I'm going to show you that quickly before I finish off this morning. So for people who are I'll show you like a simple version of 70. I'm not a fitness. I enjoy fitness. So I'll do the easy version for people who are over 70, and then maybe a more complicated version. So have a look. Yeah. Can you see me? So the step ups, if you're sort of over 70, the step up just sort of up and down like that. You can do that on the staircase in your house, just up and down and come back down again. So up and down, come back down. And if you want to go a little bit more harder, then go a bit harder like step like that. But just up and down. So that's your first exercise if you're sort of older than 70. And then second one is to just sit. So let's say this is a chair. So sit and stand, sit and stand, sit and stand. And if you feel more, you want to challenge yourself even more, then come off the seat and just bend, squat and stand, and squat and stand, and squat and stand. So you can do. The plank is always a good one. So remember the plank, either on your elbows or up on your hands. Okay, I think those three are enough. And funniest thing is, my heart rate is already jumping up. So it doesn't have to be a mega exercise for you to work out and for you to keep yourself healthy. So that's my special exercises for the over 70s, I'll say. So over 70, if you have your mom, your dad, you know, show them the video, let them just do a few, let them challenge themselves and also keep the prevention journey up. So that's my wellness Saturday for today. Remember to go for a walk, your one exercise a day, 10,000 steps if you want to do that, and just keep healthy. Next week Saturday, I'm wondering whether to talk about skincare, I don't know, but give me your views on the wellness Saturday. Now there will be no live update tomorrow because, as I always say, it's Sunday, and Sunday is for your own sort of deep practice. As I talked about physical and mental wellness at the beginning, I did not mention spiritual wellness, but spiritual wellness is as important, and everyone should seek to find their own form of spiritual wellness. I will definitely be pursuing mine with my family, and I hope you will be doing the same. Remember to call somebody today. We know everybody might appear like we have it all together, but we all are on a journey. We are all dealing with different things and different challenges, and you know, reaching out to somebody, calling them, telling them how much you love them, you know, checking on them will be definitely appreciated. I definitely would appreciate my friends calling me and my family calling me. Just reach out to somebody today, and if you're struggling or you're suffering, don't do it alone. Talk to someone, you know, and just express yourself. Don't suffer alone. Anyway, guys, enjoy the rest of your Saturday. I'm going to really go and enjoy mine now. I have a celebration in my house. I'm going to go and enjoy your Saturday. Have a great weekend, and we will do this again on Monday. Bye.